This is Spine Academy, spine surgery education resource provided by Tanner Spine Surgery at Tanner Medical Center. Together, Tanner works with your spine surgeon's office to take care of all of your spine needs, including spine surgery, non-invasive spine surgery, sports medicine, and rehabilitation. Your Tanner resource for these services is the Orthopedic and Spine Coordinator that can be reached at 770-812-5547. Welcome to Spine Academy class. We want to provide you with valuable information on what to expect before, during, and after your surgery, an opportunity to prepare for surgery, an opportunity to ask questions that are specific to you, and help lower your anxiety level by being informed and supported. After the class, please take the quiz that is online at tanner.org. It can be found under Services, Spine Surgery, then Resources, or you can scan the QR code that is in your Spine Academy binder. If you prefer a written quiz, please ask your Tanner nurse. Also, please complete any health questionnaires that have been assigned to you through MyChart if you haven't already. This is the spine anatomy. The cervical or neck vertebrae are numbered are 7. The thoracic or mid-back vertebrae are 12, and the low back vertebrae consists of 5 vertebrae. The first illustration is an anterior view. This is what your spine would look like if someone was looking directly at you. A right lateral view is what your spine would look like looking from your right shoulder, and a posterior view is what your spine would look like looking from behind you. Please note that there are several types of surgeries discussed in this presentation. Your surgical procedure is determined by your diagnosis and condition. Each surgical case is individualized and outcomes may be different. Please refer to your surgeon's plan of care for you and your planned surgery. Laminectomy. What is it? It's removing or trimming the lamina or the roof of the vertebrae to create more space for the nerves. Why do it? Because narrowing of the spinal canal results in the crowding of nerve roots in the canal. The goal is to relieve pressure on the spinal cord or spinal nerve. Discectomy, what is it? It's removal of a herniated disc, giving relief to the nerves. Sometimes this is done with a microscope through a laminotomy, which is an opening created in the lamina. We do it because part of the disc has bulged, herniated, or leaked out from its normal space and causing nerve pain. The goal is to relieve pressure on the spinal cord or spinal nerve and reduce pain. A spinal fusion is 2 or more vertebrae that are united together so that there is no motion between them. It's done to treat a pars defect, which is a fracture of the vertebrae, to correct a deformity, and improve stability between the vertebrae when there are 2 or more vertebrae that are causing pain with movement. The goal is to obtain a solid union between 2 or more vertebrae using bone or hardware and to restore lost disc height. Cervical or neck spine surgery. Approach. Your surgeon may go in from the back of your neck for a laminectomy, discectomy, and fusions. A cervical laminectomy cannot be performed from the front, but a discectomy and fusions can be. You may or may not be admitted to the hospital after this surgery. This depends on the number of levels performed, the complexity of your surgery, and your past medical history. Thoracic or mid-back and lumbar or low back spine surgery, laminectomy, discectomy, and or fusion. Approach. Your surgeon may go in from the back, posterior, side, lateral, or the front, anterior. You may or may not be admitted to the hospital after this surgery. This depends on the number of levels performed, the complexity of your surgery, and your past medical history. What should your surgeon and your Tanner team know before your surgery? Do you see a specialist like a cardiologist, pulmonologist, neurologist, nephrologist, endocrinologist, etc.? We also would like to have a complete list of your medications, including vitamins, over-the-counter medications, or medications that you only take on occasion. Blood thinning medications are especially important because you may need to hold these medications. Do you have a plan for surgery? Is there someone that will be helping you at home? Coach's role. Your coach is the person who will be assisting you at home after your surgery. This person can be family, friends, or an outside resource. It is important to have help depending on your surgery and your progress. The coach will provide motivation and encouragement, prepare the home for a safe return, be knowledgeable about the home exercise program, review new medications with the nurse prior to discharge, understand all discharge instructions, encourage attendance at follow-up appointments and therapy sessions, and recognize the signs and symptoms of complications. Please remember to arrange transportation for you when you're discharged from the hospital and arrange for a caretaker to be with you for at least 24 hours after surgery. Use this time to decide if you have any questions for your care team. What to expect at your pre-admission and testing or PAT visit. You may also hear this referred to as your pre-op appointment at Tanner. Prior to your visit, a nurse will have called you to go over your health history, allergies, and medication. For your safety and preparation for your surgery, you'll be asked several times to verify your name, birthday, allergies, and the procedure you're having by staff in different departments. During your in-person visit, a nurse will review all your medications and go over instructions for you for the evening before and the morning of surgery. You'll have a nasal swab to screen you for staph colonization, or MRSA, and blood work. You'll receive directions to properly use the Sage wipes, the antiseptic wipes, the night before your surgery to reduce the risk of infection. You may see someone from the anesthesia department. You may have an EKG, and you may have x-rays. We want you to be as healthy as possible before surgery. Here we call it optimized. There are certain health conditions or habits that can delay healing and increase the risk of complications. Those are BMI greater than 30, uncontrolled diabetes, poor nutrition or malnutrition, nicotine use, or high blood pressure. Tanner Health Systems Get Healthy, Live Well offers evidence-based programs in the community to help you on your journey to a healthier life. All programs are taught by certified lifestyle educators. These resources can be found at www.tanner.org/livingwellresources. What to bring with you the morning of your surgery. Loose, comfortable clothing to wear the duration of your stay. Your surgeon will let you know how long you should expect to be here. Even if you plan on going home the same day, pack an overnight bag in case your surgeon would like for you to stay for observation. Flat supportive walking shoes that are non-slip with an enclosed heel. No Crocs, slippers, or slides. Any specialized home medications in their original container. Do not bring your medications in a pill organizer. You will not take your own medications except under special circumstances. If you've been prescribed a brace, a walker, or any other assistive device, bring those if you already have them. A CPAP or BiPAP machine if you plan on staying overnight. Contact lens solutions and containers, but don't wear your contact lenses the day of your surgery. If you have an advance directive or living will and Tanner does not have a copy, please bring one of those as well, and bring your Spine Academy binder. Someone will call you around lunchtime the business day before your surgery to give you your arrival time. What not to do before your surgery. 24 hours prior to your surgery, don't drink alcohol, do drugs, or use tobacco or nicotine. That includes beer, wine, vapes, and smokeless tobacco. Don't have anything to eat or drink after midnight except for what your PAT nurse has advised. Do not bathe the morning of your surgery unless advised by your PAT nurse. You will use the wipes again when you get here. Do not shave in your surgical area for at least 2 days before surgery, including the morning of surgery. Your PAT nurse will go over this in detail with you at your appointment. Do not wear nail polish or fake nails. No makeup, including foundation, eyeliner, mascara, lashes, or lipstick. No body piercings. Do not apply lotions, oils, powders, or deodorant the evening before and the morning of your surgery. We want the Sage wipes or the antiseptic wipes to be all that is on your skin. And please leave all your valuables at home. The morning of surgery in Carrollton, you'll enter through the outpatient and surgery entrance on Clinic Avenue. Free valet parking is provided. Check in at the registration desk on the left. They'll give you a wristband. Please make sure your name and birthday are on the band. Then you'll sign in at short stay. That's on the right. Pre-op time waits vary, but your family will be with you during that time. If you're having surgery in Villa Rica, enter through the surgical services entrance on Old Stone Road. This is also the emergency room entrance. Take the elevator to the second floor. When you get off to the second floor, you'll see the registration desk for outpatient surgery. Get your wristband and confirm the information is correct. Pre-op times will vary, but your family will be with you while you wait. The day of your surgery, you'll be provided with a hospital gown and non-slip socks. You'll be assisted with a second application of the Sage wipes or the antiseptic wipes and have a nasal antiseptic applied. A pre-op nurse will review your paperwork and medical history. It's important to tell your nurse if you've had any changes in your health since your last visit with your surgeon or your pre-op appointment. Tell your nurse if you have any open wounds, rashes, or sores. Your medications will be reviewed, and the last time you took each one will be documented. You'll be asked about the last time you had anything to eat or drink. An IV will be started, and appropriate medications may be given, including antibiotics for infection prevention. The surgical site will be marked by your surgeon. An anesthesiologist will speak with you about your anesthesia. Pre-op times may vary. You will be updated frequently. Going to the operating room. You'll be transported to the operating room by your surgical team on a stretcher. Your family will be directed back to the surgical waiting area. They will be updated periodically throughout the procedure. Have them check in at the reception desk. This is a great time for them to go get something to eat or get some fresh air, but make sure they leave a cell number so they can be contacted. In the operating room, we'll use an operating table that is specific to your surgical approach. When we enter the operating room, your anesthesia will administer your anesthesia. The length of surgery varies and can last 2 to 5 hours. Things you may have after surgery include a surgical drain or a urinary catheter. Neuromonitoring. Once you're asleep, electrodes, which are small needles in your skin, will be placed in different muscle groups in your arms, legs, and scalp. These will be removed before you wake up. You may notice small amounts of blood where the needles were placed. When you leave the operating room, you'll go to the post-anesthesia care unit or recovery room. You may also hear us refer to this area as the PACU. You'll wake up to oxygen in your nose, a blood pressure cuff on your arm, pulse ox on your finger, a surgical bandage on your incision. Your comfort, pain, and nausea will be assessed, and medications will be administered as indicated. Your nurse may log roll you to look at the dressing if it's on your back and your incision site. You'll stay in the PACU for about 30 to 60 minutes. Take time to reflect on the last parts of the presentation and see if you have any questions. After surgery, you'll either go to the short stay unit if the plan is for you to go home, or to One West if you'll be staying with us for observation. Your nurse will monitor your vital signs, will educate you and your coach about pain management and the plan of care. If you had neck surgery, they will evaluate how well you're swallowing. Physical therapy will be in to see you if you are moved to your destination by 6 p.m. Otherwise, you can expect that your nurse will walk you. We want you to at least sit on the side of the bed the day of your surgery, and we will push you to do more. Your progress and readiness for discharge will be assessed frequently. If you stay here for observation, we will get labs in the morning to see how your blood cell count looks. You'll be assisted with your daily cares like bathing, standing at the sink to comb your hair or brush your teeth, and dressing. Physical therapy and occupational therapy, if ordered, will visit you first thing in the morning. You will have one session of physical therapy the first day after your surgery. You may have oxygen in your nose overnight if needed, and will continue IV fluids if needed. We want you to plan to get out of the bed and sit up in a chair and wear your clothes instead of a hospital gown. Remember, you are not sick, you are recovering. Your nurse will float your heels to prevent a pressure injury on your heels and help you to turn in bed if needed. This will help prevent pressure injuries or bed sores. Your nurse will encourage you to turn, cough, and deep breathe and use your incentive spirometer to help prevent pneumonia or other lung complications that are a risk of surgery. Also, sitting in a recliner will help with this as well. Your nurse will encourage you to walk or do ankle pumps to prevent blood clots. Your nurse will teach you about preventing infection, constipation, and other topics related specifically to you. Your nurse will administer all of your medications while you're here. Please do not take medications from home. If you go home after surgery on the same day, physical therapy will see you once in short stay unit if ordered and assess whether you can safely return to your home. They will demonstrate using the walker if needed and after surgery exercises. You and your coach will get the after-surgery care instructions, including medications, appointments, referrals for home health, equipment, complications, circulation hose, etc. Your coach will sign the discharge instructions. Because of sedation, you will not be able to. Once you get back home, take the rest of the day to rest while managing your pain and doing your lung exercises and ankle pumps. Your coach will encourage you to turn, cough, and deep breathe and use your incentive spirometer to help prevent pneumonia or other lung complications at a risk of surgery. Also, sitting in a recliner will help with this as well. Your coach will encourage you to walk or do ankle pumps to prevent blood clots and keep your home safe by keeping a clear path for your walker. Your coach will be available for support and help provide nutritious meals. Increase your vegetables and protein and iron to help with healing. Pain management. Everyone experiences pain differently. Your pain after surgery may be more or less tolerated than your neighbors or peers. Pain is expected after surgery. It is usually not completely eliminated. The pain medication works best when taken consistently as your pain begins to increase and before it becomes severe. While you're in the hospital, your nurse will ask you about your pain frequently. We want to keep your pain at a manageable level. Let your nurse know when you need something for pain. While you're in the hospital, the nurse will ask you to describe your pain. Is it aching, stabbing, shooting? And ask if the pain is constant or if it comes and goes. If there's a pattern, is it only there with movement? We may use IV pain medications or pills, but we'd like to begin the pills as soon as they're tolerated. Here at Tanner, we use a pain scale to help determine your pain level. Once you're home, follow the directions on the bottle. Do not take more than prescribed and do not drive while taking narcotic pain medication. Additionally, do not drink alcohol, take additional sedatives, or mix your pain medication with recreational drugs. Pain medication can cause nausea, so take them with food on your stomach to help. Preventing falls. After surgery, it is not uncommon to have a drop in blood pressure, dizziness, fainting, or a loss of balance. Never attempt to get up at home. While you're in the hospital, in addition to your walker if needed, 2 clinical staff members will assist you to the chair, bathroom, or bedside commode. Please use your call light for any needs. We are here for you and strive to give you exceptional care. Call for help before you step. When you get home, have your walker, if ordered, close and assistance when getting up if you need it. There are many things that can be implemented in the home to prevent falls. Remove rugs, extension cords, and contain animals that may trip you up. Take your time when changing position from laying to sitting to standing. More resources are available at the end of this presentation related to preventing falls. Preventing nausea. After surgery, you will first have ice chips or water. Then you can advance as tolerated to your regular diet or as directed by your surgeon. Pain medications can cause nausea. Take them with food on your stomach helps. Your surgeon may prescribe you something to take for nausea, like Zofran or Phenergan, at home. And if you're in the hospital, we can also administer these medications with an order. Preventing constipation. Constipation is a major side effect of pain medication. If you're in the hospital, we give daily medications as ordered by your physician to help. Those are stool softeners and laxatives. At home, make sure you have stool softeners and laxatives available if needed and suggested by your surgeon. Walking will help wake up your belly after anesthesia, and increasing your fluids, fruits, and fiber will also aid in constipation prevention. Preventing infection after surgery. Everyone, staff, family, and visitors who come into and out of your room should sanitize their hands while you're in the hospital setting. At home, ask your visitors to do the same thing. If your hands are visibly soiled, use soap and water. Restrict pets from the area that you are sleeping and contain them in another room when your dressing is being changed. Don't remove your dressing unless you have instructions to do so. If you're wearing circulation hose, be sure to launder them. Wear clean clothes, use clean bath towels, and sleep on clean linens. A low-grade fever is expected the first few days after surgery. We treat temperatures that are greater than 100.4. If your temperature at home is greater than 100.4, treat your fever and notify your surgeon. Make sure you have a working thermometer at home before surgery. Your dressing may be a silicone dressing with silver. This may be managed by home health if home health is ordered. This can stay in place for 7 days if not soiled more than 75%. And if this is the circumstance, please report to your surgeon or home health care nurse. Make sure all the edges are sealed and do not lift this dressing. Mesh with a liquid adhesive. This is a closure system. Do not remove this. and simple sterile dressing can be changed with the surgeon's instructions. Preventing pneumonia. Cough and deep breathe exercises. You do this by inhaling deeply, hold your breath for a few seconds, and then cough 1 to 2 times. You'll go home with an incentive spirometer. Use the mouthpiece and inhale slowly, keeping the side float between the 2 arrows. Hold your breath for a few seconds, then allow the center float to completely return to 0. Complete this exercise 10 times every hour while you're awake. Turning. Don't stay in one position for greater than 2 hours. This also helps prevent pressure sores or bed sores. You can use pillows to help wedge or prop for comfort. Positioning. Try to stay upright in a recliner. In the hospital, we can adjust the head of your bed. This helps you breathe better. Preventing blood clots. Early ambulation or early walking. Our goal is to have you walking 2 to 4 hours after you out of PACU. At home, walk 5 to 10 minutes every hour as your strength and balance improves. Increase the amount that you walk. Mechanical devices. SCDs are sequential compression devices that are used in the hospital. They are worn on your legs and inflate and deflate. At home, you may be instructed to wear TED hose or other compression stockings. Please make sure that these are removed for 1 hour every 12 hours. When you're getting ready to go home from the hospital, we're going to wait until your coach or family member or other caretaker are present before going over discharge instructions. You can't drive yourself home. Your nurse will review discharge instructions, give you and your coach education on any new prescriptions and how to recognize the signs and symptoms of complications. The prescriptions will be given to your coach, family, or your caretaker to be filled for you if this was not done prior to surgery. After discharge, if you have questions regarding your medications, please contact your physician. You will have instructions on how to care for your incision. You should not remove the dressing unless you have direction to do so. We do want you to look at your dressing and skin surrounding your dressing every day. Let your surgeon know if there's any drainage, redness, rash, or the skin is hot to the touch. You should already have an after surgery appointment scheduled with your surgeon. If not, call as soon as you get home to make that appointment. Care coordination. Our expectation is that you return home after surgery versus going to a skilled nursing facility or a rehab. The care coordinator or case management personnel will discuss your discharge plan, assist with any insurance or coverage questions, plan for medical equipment if needed, plan and communicate with referrals for home health care if ordered and not already in place. We want you to go home with your family or coach, or go home with your family or coach and home health. Home health care nursing usually comes out 1 to 2 times per week and therapy 2 to 3 times per week. If your physician prefers that you have outpatient physical therapy, that is something you'll need to discuss with them. After surgery, limit your activities for the first 24 hours. Do not make personal business or legal decisions 24 hours after anesthesia. Your judgment and mental alertness could be altered from sedation and narcotic pain medications. Do not make personal, business, or legal decisions while taking narcotic pain medications. Do not drive, operate machinery, or use power tools while taking narcotic pain medications. Rest is needed. It is normal to feel weak and fatigued after your procedure. Call 911 if you have chest pain, difficulty breathing, slurred speech, weakness on one side of your body, or confusion. Additionally, if you have loss of control of your bladder or bowels, if you had neck surgery and are having swelling that makes it difficult to breathe. Call your surgeon if you experience fever greater than 100.4 that does not resolve with medications, numbness, tingling, decreased sensation, or decreased temperature and or color changes in your extremities, extreme pain that is not relieved with your pain medication, if your dressing is soaked with blood or have bleeding that does not stop when pressure is applied, excessive swelling, red streaks, drainage, or the skin is hot to the touch around the incision, if you have pain, swelling, redness, and skin that is hot to the touch in the calf of either leg, if you have not had a bowel movement in 3 days, having abdominal pain or excessive nausea and vomiting, if your dressing is lifting off and there were instructions not to remove it, or if the dressing is soiled and you've been told not to remove it, you can call home help for this if you were ordered home help. Pain in other areas. Your hand or arm may be sore from the IV. You can use a warm compress. If it persists or get worse or you get a fever, call your surgeon. You may have a scratchy or sore throat, and that usually clears in a few days. Can I take anti-inflammatory medications like Advil, ibuprofen, or Aleve? Only if directed by your surgeon. Always ask before taking a medication in this class because it has blood thinning properties. Do I or will I have staples, and when do they come out? Depending on the dressing or closure system your surgeon determines is whether you'll have staples or not. You will know this surely when you're discharged. Staples are typically removed 2 weeks after surgery by home health or your surgeon's office. Take some time to think of questions that you can ask your care team. Rehabilitation is getting stronger before surgery. Prehab teaches you skills and exercises that you will need after surgery. Patients that participate in prehab recover more quickly. There are prehab programs that are offered in the community but will have to be ordered by your surgeon. If you are not in a formal prehab program, we will show you some exercises to do before surgery to get you stronger. Please start those today. Preparing your home before surgery. Remove all throw rugs. Move all electrical cords out of the way. Move items within reach. Widen paths for a walker if you need a walker. Check the height of your bed. Is it easy to get in and out of? If it's difficult now, it will be more so after surgery. Check the height of your sitting chair. Is it low? Can you add pillows to increase height or firmness? Have a safe place for your pets to be contained. They can be a fall risk. Have meals planned that can be prepared easily. Install handrails on stairs if needed. Consider non-slip tread on stairs or in the bathtub or shower. Install grab bars near the toilet or in the bathtub or shower. How far is your bathroom from your bed? Consider a bedside commode. Have lighting like night lights with motion sensors or lamps in hallways, bedrooms, and bathrooms. What contributes to falls? Feeling weak, dizzy, tired, sick, or simply not strong enough to stand or walk. Medications, slippery wet floors, or obstructed pathways. How can we prevent falls? Increase your strength, complete prehab exercises, call for help before you get up, stay hydrated, check your vision if needed, let your surgeon know if your medications causing you to be in a fog, sit in chairs with armrests that don't have wheels, wear firm flat shoes that do not slip, replace rubber tips on canes or walkers if you need one, rise slowly from sitting to standing, and always think before you move. The following sites are the prehab exercises. Quad sets. Tighten the muscles on the thigh of the straight leg and hold for 5 seconds. Do this 10 times on each leg and do this 3 times per day. Straight leg raise. Lie on your back and bend one leg. Keep your other leg as straight as possible and tighten the thigh muscle as you slowly lift the leg off the bed. Lift as much as you can, but no more than 12 inches. Hold that position for 5 seconds, then lower slowly. Do this 10 times on each leg, and do this 3 times per day. Long arc quad. Straighten the leg while tightening the thigh muscle. Hold for 5 seconds, then slowly lower. Do this 10 times on each leg. Do this 3 times per day. Tricep dips in chair. Place both hands on a stable chair and push your body up out of the chair. To prevent a fall, do not use a chair with wheels. Keep your buttocks over the seat of the chair. Do this 10 times. Do this 3 times per day. Hip abduction. While lying on your back, lift your leg 2 to 5 inches off the bed. Move your leg out and in, like a snow angel. Do this 10 times. Do this 3 times per day. Our physical therapy team will work with you to improve your functional abilities and will teach you proper body mechanics and safe procedures for transferring in and out of the bed, walking with a walker if you need one, and home exercise program, climbing stairs, getting up and down out of a chair, using a gait belt. Please note that these are not provided, and if you prefer one, you will need to purchase one before surgery. Preventing falls, proper positioning, pain management alternatives, and other equipment education and device training is needed. Your recovery is a commitment for us. It is very important to work hard with therapy whether you are at home or in the hospital. At home, you may not have home health physical therapy ordered. You and your coach will need to commit to completing the exercises that were given to you during your hospital stay. Occupational therapy. Occupational therapists work with patients to improve functional abilities to complete activities of daily living. They teach proper body mechanics and safe procedures related to activities of daily living. Not everyone is ordered occupational therapy. If you are, this is what you can expect from training. Help with dressing, bathing, going to the bathroom, grooming and hygiene, transferring, strengthening exercises and home exercise programs, assistive device training, and fall prevention. The illustration is of an Activities of Daily Living or ADL kit. ADL kits are available in our gift shop, or you can purchase one prior to surgery. Spine precautions for back surgeries. No BLTs. No bending forward. No lifting anything heavier than 10 pounds, which is about the weight of a gallon of milk. And no twisting. Do not twist your body. Log roll. Your shoulders, hips, and heels roll together like a log. No twisting. Lying flat in the bed, turn your shoulders, hips, and heel at the same time and get on your side. Push up with your arms as you lower your legs. Move as one unit. Then sit upright. Transferring in and out of the bed. Walk up to the surface with your walker. Turn on the leg that is opposite your surgical side until your buttocks is square against the bed. Place your hands behind your hips on the bed and scoot into or out of the bed. Use your arm strength. Getting into the car. Walk up to the car with your walker as closely as possible. Turn on either leg until your buttock is parallel with the car. Reach back with your hands and scoot into the seat. Use grab bars for stability. Rotate your legs in the car. Equipment for back surgery, back brace. You may or may not be prescribed a back brace. If you are, your surgeon will have already obtained this for you. A standard rolling walker is used to help support your surgical. The standard rolling walker is used to help support you as you're walking after surgery. You may or may not have a walker prescribed. A gait belt is placed around your waist to help support you while walking to prevent a fall. These are used while you're in the hospital. If you want one for home, you'll have to purchase through a retail vendor like Amazon or eBay. Spine precautions for neck surgeries. No excessive movements of the neck. Shoulder and neck relaxation exercises. Softer food if you're having trouble swallowing. The equipment for the neck includes a soft neck collar. You may or may not be prescribed a soft neck collar. It is worn as needed for comfort. A hard neck collar is worn always except to perform hygiene. Thank you for choosing Tanner Medical Center for your spine surgery. Please remember to take the quiz that is online at tanner.org. It can be found under Services, Spine Surgery, Resources, or you can scan an available QR code. Also, remember to complete any health questionnaires that may have been assigned to you through MyChart if you haven't already.